I truly believe, having run for state office myself, that politicians really need to work for us. And I say us in this general sense of citizens in the community. And I decided this year, even after many years of being the executive director, I need to take a more proactive stance on advocacy. So I decided to become a registered lobbyist. I'm exclusive, of course, to our organization, but it allows me to have more of those face-to-face connections now with legislators that are not my legislator. And that's a critical piece to bring back to our members when I'm going out to visit them.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Alan DeYoung, Executive Director and CEO of the Wisconsin EMS Association, or WEMSA. Alan, welcome back to the podcast.
Thank you, Joanna. Thanks for having me again.
Hey, so listeners, I had Alan on the podcast. He was actually one of my very first guests. Alan, you were on back in November 2022. So what a pleasure to have you back. And we have so much to dive into. But for my listeners who didn't hear the first podcast, and I will put a link in the show notes, by the way, tell us about WEMSA.
Yeah, WEMSA, so the Wisconsin EMS Association. So we represent the first responders or 911 medical response in Wisconsin, all their agencies and individuals, and we advocate for them, we educate them, and we support them in any way we can, because they are truly the members of life and death in our communities.
And so, Alan, just for the sake of my listeners, when I call 911 and I need medical help in Wisconsin, those are your members. It's not fire and it's not police.
Correct. It's any of the emergency medical responders all the way to your critical care paramedics who pretty much operate as a physician would or close to a physician in the field, making sure they can save your life.
And when we talked back in November, you talked about how fire and police are mandated by law, but not EMS.
Yep, pretty much. You always have your police, like in many areas, sheriff's departments, as long as you may not have a local police department, but they're contracted. But for an EMS, at least in Wisconsin, and actually about 30, I believe it's 38 other states as well, EMS is considered non-essential. So there's the option that a city or village in Wisconsin does not have EMS, and there's nothing to mandate that. So you can call 911 and nobody shows up.
Oh my God, that is terrifying. Has anything changed in that situation since November 2022?
Not in that situation. Thankfully, it's kind of a no-brainer that you need to have medical response for your communities. So pretty much everywhere it does. We've had, obviously, departments close over that time. These municipalities struggle to find somebody to cover for 911, but most of the time they still have it. It's just starting to learn now more about how we've relied as communities across the whole United States on EMS being volunteer. They're subsidizing it for us by being a volunteer. That model slowly is starting to kind of erode because people aren't volunteering anymore. They can't financially, they can't work-life balance. They don't want to deal with the mental health behind it and seeing people at their worst. So it's only changed in that sense, but we've been very proactive with making sure we're supporting the departments, all of our members, in fact, even non-members, just to make sure we don't lose more EMS because that hurts everyone.
But you've got new legislation that I think you're trying to push through related to the education
Yes.
for EMS. So tell us about that. That sounds really exciting.
So we believe that, well, one of the two major issues in a lot of industries is staffing and funding. So how are we going to try to tackle that staffing piece and get more anyone, citizens, community members to better understand EMS is to get them involved in it. So this bill, we're hopeful that it's going to be passing because it's already gone through all the hoops that it needs to. It should be passing soon here. This essentially will make EMS education, initial education, free in the state of Wisconsin through a reimbursement program. So anybody can take a EMS program, become an EMS emergency medical responder all the way to a paramedic. And when they are finished and licensed, they can get reimbursed.
Alan, what kind of money are we looking at here?
The cost of the programs themselves are actually not too bad, anywhere from like $500 for just a basic emergency medical responder, so not a difficult program overall, all the way to about $15,000 for a full paramedic 2-year program. And the overall cost on the state is very minimal. I mean, we're estimating anywhere from 6 to 7 million a year only.
Tiny.
Yeah, tiny compared to $100 billion state budget. So we believe that this program is going to drastically help our members, not only with their budgets, because individual or the employer, whoever pays for the program initially, gets the reimbursement once they're done. So employers could mean anybody. It could mean schools, it could be manufacturers, it could be in associations that want to train their staff, knowing that they're going to get reimbursed. I mean, obviously in Wisconsin, we passed this. Maybe it'll be something they'll pass in every state. Who knows?
Let me roll this back a little bit. You're saying that any employer could say to any employee, get this training. So like any company, a manufacturing facility, a hospital, a school, a retail store?
Anybody. So that's the way the bill is written, is individual or employer, and it's any employer. Obviously, the only requirement is just that they get licensed. They don't actually have to work in EMS afterwards. So
Oh.
this initiative is not to force people into EMS. It's to, one, not only get community members trained on just how to respond in their own communities, how to respond to their neighbor, they're at an event, somebody's having a cardiac emergency, somebody's choking, all these different things you could think about that could happen. Having somebody to respond when everybody's kind of standing there because they got that training. So it's really just an initiative to grow awareness around EMS and also to basically remove that financial barrier that many individuals look at, knowing that they don't want to take on student loans to go to school, but that this could either become a full career for them if they want to, or it could be a stepping stone for them and they get that first certification or license, and then maybe they go on at a different career entirely, but they got that starting in EMS. They got started there, or at least they got introduced to it. Associations always think about tackling that main problem, but there's always ways around it to just get the community more aware of your industry, and suddenly they will become more advocates for it because they understand it now.
Hmm.
And that's a key piece.
Wow, I love that. So like a neighborhood, for example, could say, hey, we're a little bit far away from the local EMS department or the local fire station. So let's get a couple people trained up so that until they come, nobody dies.
We actually have a member that is an HOA.
Oh, wow.
They are actually too far from their local EMS. It takes them about 35, 40 minutes to respond just because they're out in a rural area. And this is funny enough, it's in another state too. But their HOA is trained. Like community members are trained within the HOA. They have AEDs, they have medical bags, and a couple of their HOA board members are actually trained as first responders. So yes, this is absolutely something that communities can do. And we're just making, at least in Wisconsin, we're making it free. We're incentivizing you to go get trained to help others.
Well, we got a lot to talk about when it comes to WEMSA, but I want to get to your journey because you have a lot that you've done in the last 2.5 years. You finished your master's degree and you're working on a doctorate. So please tell us about this.
Sure. Yeah. So I actually completed one of my first masters about 10 years ago, and I knew that was just kind of a stepping stone. I knew I wanted to get my doctorate in something, and not just anything. I wanted something related to what I want to do and something that's more versatile. So I ended up actually starting a program in healthcare administration. That's when I finished my second master's in healthcare administration.
What's the first master's in?
It's actually in marketing.
Oh,
Undergrad in IT, got into marketing because that's a key thing to understand, especially in this world, even with AI. I'll say that. And then healthcare is obviously, we are a healthcare driven organization. A lot of my past history has been in healthcare, and it's something that I believe is just critical because healthcare affects every single person in our entire country. So my goal is then I'll be finishing my doctorate hopefully this next year. I have about a year left. And from there, I mean, I'm continuing what I'm doing. I enjoy doing it. And I think this will just empower me to better understand our healthcare system, which a lot of people believe is very broken. So how do we fix it? And to better understand the structure behind it, the operational piece, we can get more efficient. We can help save more lives potentially.
so Alan, you're getting your PhD in healthcare administration.
Yep.
Tell us about the thesis.
Officially, it's a doctorate of healthcare, the DHA program, they call it. So obviously, I'm going to take on a focus of EMS. I haven't quite decided what I'm going to finalize in here as we're going through all these different classes, but I do want to do something around EMS just because I am passionate about it. Although I don't have a direct background in it, like many association professionals, we don't work in the industry, but I have always believed that that is a key benefit, actually, versus seeing that as a weakness of an association professional that may not be in that industry, is you remain unbiased. Everybody, that works in the industry has different experiences, different viewpoints, different, what do they think the future of that industry should be? I've always taken it as, look, I have not worked in it. I have not taken the tests for it. A lot of people complain about like national tests and things like that. And I don't need to know that piece of it. I need to know, how do they operate as an organization? Where do we play that role in their operations? Clinical care, that's what they're trained in. I'm not going to tell them how to do clinical care. I'll bring in the experts to tell them. I'll look to our medical director to tell, the real things to do for clinical care, the best standards of practice. But when it comes to operations, when it comes to support and making them run efficient or get better patient care, implement programs, how are they going to fund those programs? You talk about, oh, do this, do that, do that. We can do ultrasounds in the field. We can do whole blood in the field and all these new programs. Well, how are we supposed to pay for them?
Right.
And so that's where the associations play a role of doing that research, doing that investigation, advocating specifically for funding that can support these programs. And we play that consultant role. Now we can tell you how you're going to do it.
Well, I don't know. With all this education, I don't know that you can still say that you're not part of the field. But let me touch on something that you just mentioned. You talked about advocacy. You're now also a registered lobbyist. So talk to us about the lobbying that WEMSA does and why you decided to become a registered lobbyist.
Yeah. So to provide some background, we've had a contract lobbyist for almost 30 years. And the same contract lobbyist, which any contract lobbyist is going to represent a lot of organizations. And that's not a bad thing. A lot of times they're known really well at your state capital or even at our capital federally. So we focus obviously on a state level. And I truly believe, having run for state office myself, that politicians really need to work for us. And I say us in this general sense of citizens in the community. And I decided this year, even after many years of being the executive director, I need to take a more proactive stance on advocacy. So I decided to become a registered lobbyist. I'm exclusive, of course, to our organization, but it allows me to have more of those face-to-face connections now with legislators that are not my legislator. And that's a critical piece to bring back to our members when I'm going out to visit them, is, hey, I've actually met with your legislator. I know them, or started to get to know them more. I know their background, and we can work together now, having that connection both with their constituent, our member, and with their legislator who I've been meeting with. That is a key piece to be able to speak and show the work that associations do in advocacy. A lot of that background you don't always see. You might see something with a hearing and your association testifies, but when you visit your member and you can tell them specifically, yes, I met with your representative. Here's what they had to say. And we can work together on this solution. And that's way more powerful of a message for membership, especially for renewals and for getting new members, is having that connection, that relationship.
Well, but I think on the flip side too, you're able to then connect with the legislators and really speak very authentically about the member experience because you're out in the field.
Correct.
Let's transition to WEMSA because 2.5 years ago, you talked about how you like to visit your members. And, during the prep, you talked about how you are doubling down on these in-person visits. And I think that post-pandemic, in this AI world that we're now living in, talk to us about why that's so important.
That is beyond critical, I think, especially for any association, is with AI writing everything for you or writing your emails or sending your emails or things like that. It's just so much less personal. And people are starting to recognize that. And I think for any industry, any association, you have to be able to make these face-to-face or even virtual or even phone calls, but having those conversations are going to be, I think, the key motivator for people to renew their membership, to join. We specifically had an organization that was never joined us before. That is a large organization that it was due to these advocacy efforts. It was due to them seeing us take a proactive stance, visiting our members, visiting with legislators. And just by seeing that, they saw the benefit behind it without even looking at the rest of our benefits. They just saw they wanted to be part of that. So this in-person bit, and not even bit, but in-person initiatives are just monumental. I mean, truthfully, and we're going to try to get more and more and more of these, as much as we can. It's easier because we're a state, of course. We represent Wisconsin, so it might be a little harder.
But that's still a lot of driving.
It is. People don't realize from the bottom of Wisconsin to the top of Wisconsin is 7 hours.
Oh,
I could cross probably, I think, 6 states in 7 hours if I leave this state.
That's right.
So it is a lot of driving from time to time, but at least right now it's typically once or twice a month. And we basically coordinate it. We try to map out entire counties or regions or things like that. Or if I'm going out to visit with the legislator and I might have some time on the way back, we will go and visit a couple of departments, a couple of our members and even non-members, just to show that, look, we're here. You could put a face to the name. We're not just some outside organization that you never hear from, that you joined and that was it. And then you got a bunch of email communication, but nobody's ever talked to you.
Yeah. Alan, who's we? Who's doing these visits?
So myself and our membership manager also comes with. And then if we host any education, our education coordinator would also come with. We only have a staff of 3, so this is it. It's critical that people see that. They see that, wow, these 3 people, these 3 staff, these 5 staff, these 10 staff, well, even if a little bit larger, they see them and go, wow, these people are trying to advocate for us. They're really trying to help us.
And working hard for you, right?
Yeah. They're like, wow, you drove all the way out to just visit us? I mean, well, yeah, we visited other people too, but yes, we did drive out just to visit you because I want to see what you're dealing with. I want to hear your challenges. I mean, it's not necessarily a joke because it's a fact. I visited a department that they told us about one patient they had that called EMS 700 times in 1 year. You're talking multiple times a day. And how does that affect that department?
Wow.
And so you would never hear about that otherwise. This face-to-face visit allowed us to get really into the details of what their department is dealing with. And we can take notes of that. And now I have that anecdotal story that it actually happens to be fact. And we have stats to back it up too. And what that does. And so we can use those anecdotal stories to their legislators now. We can use them to say, hey, look at your district. All of your district is now members of our association, and we've gone out and visited them, and I've talked to them face to face. I know what their challenges are. So you, Mr. or Mrs. Legislator, you're going to listen to us now.
Right, right.
Because I will talk to your members. I will talk to your constituents. And if you don't work for the people, then maybe, somebody else should, kind of thing.
Right, right. Well, as a small staff, how are you leveraging tech? Because there is a lot of tech that kind of promises to help small staff. And you're a techie, like you said, undergrad in IT. So give us some secrets. What have you been doing recently?
I think the easiest thing any association could do is just do a tech stack review. And I know there's plenty of consultants that'll do this too, but even if you want to do it basic yourself initially, just review all the tech you have that you're paying for and where are the overlaps or where are the disconnects. This system doesn't talk to this system. This one takes a different login. You got to think of your members every time that they're looking at a career center, they're looking at a learning management system, looking at an association management system. Do they have 3 separate logins? Or are we using some type of SSO? Or that is critically important to look at all of the tech, how much it's being used, and can you leverage some of the tech you're using to either do more or eliminate some of that tech because some of the other stuff has added features that you aren't using that could support the organization more to free up your time to be able to do these member visits. We have to be able to free up our time.
Yeah.
And not just through automation too, and not necessarily using AI, although we do for certain things. But if we can free up the operational piece of our time as much as we are able to, it allows us to focus on the stuff that matters.
So, Alan, is it working? Give us an example of how tech has allowed you to focus on being more there for your members.
Yeah, I would say one of the major changes was actually through our AMS implementation and what it did to automate many of our bookkeeping and financial pieces to the point where we actually had to look at our staff structure and say, look, this position isn't needed anymore.
Oh. Ooh.
And that always seems kind of negative in that sense, but we also look at sustainability. If we are effectively looking ahead at what the economy could be, what our industries individually can be, we want to make sure we're proactively prepared for anything major. And doing a tech stack, looking at these pieces to make sure that we're not spending money where we don't need to be. So we're freeing up some financial resources in case elsewhere we're impacted financially. A lot of grant programs and things have gone away. So you can't rely on those per se. And then how are you structured in terms of your staff and what programs are you going to focus on? We've done pilot programs in the past. And actually many years ago, we started one as a pilot for students that were in EMS programs to introduce them to us, what resources they have. But we ended up cutting that program because it was just too much, and not even really too much financially. It was just too much staff time involved in it, and it wouldn't have that same impact. And then instead, we ended up doing a student day at our conference, and that has shown way more impact and has grown. It's actually tripled over the last 3 years in size, and that has been monumental. So it's just looking at, again, the tech piece, where you're focusing your staff, and does it actually help your members in the end then? And where can you adjust?
Yeah, that's definitely a discipline to do that and get rid of programs when they're not really, generating the return on investment or really benefiting the members in a meaningful way. And I think small associations have to be much more disciplined about it. I think larger ones, because they have the money, they get away with more stuff.
Yep.
Alan, it's July 2025. What are you looking forward to for the rest of the year?
We're definitely looking forward to, obviously, I talked about our bill passing. That's going to be a major piece for us in Wisconsin for our industry and for communities. And then we're actually focusing on other non-dues related programs that still, again, not just financially help us, like a revenue generation, affinity type programs, but where are we making a real impact on our members. And it's through these visits that we started compiling some of this data, even if it's anecdotal, and we're learning about how they're operating and where are those shortfalls. So we're evaluating right now, actually, with some data behind it of where can we utilize some of our connections. I've always said WEMSA is a connector. Associations a lot of times have a lot of connections to consultants, stakeholders, legislators, whoever it might be. And how do you use those connections, not just, again, for non-dues revenue, but that's a piece of it because we got to support our operations, but in the end, support the member and what they do.
Ooh, well, give us an example of how a connection generated non-dues revenue.
Well, I can tell you what we're working on right now. So one of the major pieces too with EMS is when you're in an emergency, they're not asking you about your insurance.
Right.
They're there to save your life. So many times they may not get that information. So you might get an ambulance bill in the mail and you go, oh, my insurance didn't pay for this. So now you're going through those process of trying to submit it to insurance, make sure that insurance pays for it. Or if that person never responds, like they get a bill because they're in this patient pay category, you may not ever find insurance for that patient. And if it's a municipal based EMS, they may not follow up with that bill after so many years. They may not throw it to collections. A lot of municipalities don't do what's called balance billing. So with that, we're trying to see how do we help through our connections with hospitals that after they've helped the patient, after they've got them stabilized and helped out, that they're the ones typically collecting the insurance information afterwards. So how do we work with our local hospitals to get that data back or proactively get community members to, I don't want to say give their data. I know it sounds terrible, but to give it for the sense of, look, we're not going to send you a bill because we have your insurance. Your insurance will pay for a certain amount. And look, we're not going to send you a bill.
But help us get funded.
And that's the same thing. So we're positioning this as not only from a taxpayer if EMS can't collect from the insurance or from anybody, in that matter, that money's got to come from somewhere. So it's going to come from the local taxpayer. So it incentivizes local taxpayers to say, yes, here is my insurance, because I know that not only will I not get balance billed at the end of the day because you have my insurance, my tax dollars really shouldn't go up because they are getting the reimbursement that they're supposed to be getting for that EMS ride. And so this is a program we're trying to work on not only with the community, but also with hospitals as well, which that can be difficult. We're dealing with HIPAA information. And then also with billing companies. How do we get our vendors involved in this? Because a lot of times billing is based on how much receivables they get from billing. And if they're not able to collect, well, they're making less money. So it incentivizes.
Well, Alan, how are you making money off this?
So that would be part of it is either it's just helping to retain membership by implementing these programs within the community. It could be working with the hospitals. Look, you're supporting your local EMS. If your EMS department closes, your hospital is not receiving transports then. So that is a key piece of a lot of this too, is because a lot of the transports, whether trauma or related, cardiac, those result in typically bigger hospital bills. So they're incentivized to make sure people get there. And then a third piece of that is the billing companies. If they're not collecting this revenue, but we can help them find that information, now they can bill for it. So they get their percentage. So maybe part of this, and again, this is just trying to work out, what does this program look like? Do we get 1% of that just to help us operational?
Is there a fee for your service, et cetera?
Yeah, exactly. We don't want to charge our members. And we don't want to charge the community members either, because that wouldn't make any sense. But it's like, how do we be that bridged connection between the public so they understand EMS, they understand why this is important, EMS themselves, so they have the information too. And then again, the billing companies to make sure that they're able to bill properly the right insurance for this. And that's a piece.
Right. So it's interesting. So it's kind of non-traditional, non-dues revenue, but definitely a need in the community and in the industry, in the profession.
Yeah. And these needs, the only way to find this out is through these visits, these department visits, these anecdotal pieces. When you Oh, that's really into the weeds, is it not? Like, you really got to understand the billing side of this stuff and what are they dealing with and why are they writing off $2 million in billing? Oh, $2 million. What if we could collect even 200,000 of that?
Right, right.
Still, and not collecting from the person, we're talking about from typically insurance companies or programs like Medicaid or Medicare where they didn't have the right information. So they couldn't get the right insurance information for that person. I always believe that the associations that do one of two things is either they have some type of educational program that is not strictly a conference, because that's very risky. We found that out through COVID, but doing some type of educational program that's very robust, that maybe a certification program or some type of license piece, or the other side, associations that implement programs that may be very unique to their industry. That's the associations I typically have seen thrive really well and survive through membership renewal periods or like breakups of their industry. You got to think how many schools might be broken up because of grant funding and things like that could hurt an association that represents schools. So it's like, how do you implement these programs to be sustainable as an association? And then you're supporting your members so they don't close.
Amazing. Well, that's a great formula for being very high touch, but also being very, very relevant. Alan, a pleasure as always. I'm going to have you back, and I won't wait 2.5 years because I know the next year you're going to be doing amazing things. Thank you for being back on the podcast.
And thank you for having me.
Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends.